So how are you doing?
Well, self-quarantine at home. It's been a month now. Sadly, I have another friend who died earlier today, a women's rights defender. She is the third of my friend who died over the last 3 weeks.
I see. Our condolences to his family and to you too, having lost good friends. So that means that nobody seems to be safe from this virus, right?
Oh yes, yes. The fact that we have close friends who die, this outbreak is not only a statistic. Officially, we have 120,000 something people under the government monitoring because of the coronavirus infection. But we are also having more than 42 doctors and nurses who died because of the outbreak, and hundreds of doctors and nurses, ambulance drivers who get the infections. Thus, they have to isolate themselves. You can imagine if we have hundreds of doctors who have the infection and they cannot work, it will affect the operation of our health system. At the same time, the lack of testing is rampant all over Indonesia. A country of 280 million people, we have less than 900 ventilators. At the same time, the government is not transparent. The statistics between Jakarta and provincial capital do not match. It is quite chaotic. At the same time, the police is arresting people who criticize how the government handling the outbreak. Right now, there are nearly 60 people in prison because of criticizing the government.
And
so you're saying that testing is one of the biggest problems now, right?
Yes. So far, we have only less than 30 laboratoriums all over Indonesia that can do the testing. Indonesia has 34 provinces. There are more than, we have only 24 provinces that have the laboratories. And in fact, they were only set up in a hurry because as of early March, there was only one laboratory that can do the testing. So the government, of course, is working pretty fast, I have to say that. But still, there are still more than less than 20 provinces with this laboratorium testing to test the coronavirus infection.
And what's the stringent measures that the government announced? And do people comply with those measures, Andreas?
It depends. In many areas, people do not comply because, again, people say that we need to work. Street vendors, transportation workers, people who work in the security sectors, in the market, logistical sector, they still need to work because if they don't work, there is nothing to eat. And the government estimated that about 3.8 million workers have lost their job, and it is going to increase more than 5 million in the next 1 week, 2 weeks.
I see. The back on the question of testing, because of what you said is the inadequate testing earlier, so the figures released by the government on the infection cases and the deaths are not that reliable then, right?
No, it is not reliable. Until now, we do not know for sure how many infections are there in Indonesia. There is a province, for instance, day 1, it was announced that they have 16 infections. Day 2, 17. And day 3, 15. How can the number of infections going down? And there is also a statement that someone who already died because of coronavirus turned out to be negative, but he already died. And a lot of people who were buried with the so-called coronavirus COVID-19 protocol without being tested. And most of them were suspected wrongly to have dengue fever, when of course they are not having dengue fever. Without this accurate data, without this accurate statistic, medical expert, mathematicians they cannot predict a good model. And without a good model, without an understanding about the real number, the government will have difficulties to handle the outbreak. And of course, Indonesia is a archipelago with more than 17,000 islands, 34 provinces, many ethnic cultural groups, many religious groups. It is a handicap to impose a single policy nationwide. One province is different from another province. One ethnic group is different to another ethnic group.
But overall, you think the government is catching up now?
Yes, I would like to say the government is catching up. And most importantly, civil society group, businesses, they are helping. A month ago, we were running out of masks. A month ago, we did not have adequate hazmat suit for the medical workers. Thus, there are many medical workers who got infected and they died or infected. But a month from March, I think the number of hazmat suits have been catching up. Now it is rare to see nurses or doctors using raincoats or plastic rubber boot going into the hospital. We are having more and more medical equipment. The problem, of course, is the PCR and the reagen to do the testing, as well as ventilators, life-saving ventilators. We are only having less than 900 ventilators nationwide, and this is the country of 280 million people.
And what about the measure of lockdown, shutdown all the business activities? Have Indonesian announced lockdown and under state of emergency in dealing with COVID-19?
The management is quite complicated. The lockdown is to be declared by a governor. Indonesia has 34 provinces, meaning that we have 34 governors. But to declare a lockdown, the governor needs to get the approval from the Ministry of Health and some other government ministries in terms of social, political, and economic measurement. Right now, Jakarta is under a partial lockdown, and also some other smaller provinces. But the most important is Jakarta and the greater Jakarta area, which is under West Java and Banten provinces. Those two provinces are also asking for, West Java especially, are asking for a lockdown, especially in the outskirts of Jakarta. Jakarta is the epicenter of the outbreak. About 50-60% of the infection happening in Jakarta.
Andreas, you were talking about the lack of transparency on the part of the government. Besides the question with the testing, are there any other incidents that reflect the lack of transparency?
In February, when Harvard University questions the Indonesian government statement that there was no infection in Indonesia, the Minister of Health says it was insulting. He denied that there is any infection in Indonesia. And then, of course, there are ministers who joke that this virus will not go to Indonesia because of quote-unquote red tape. Another minister say it is not going to happen because we are hot, a tropical country. The virus cannot live in a country like Indonesia. Because of undermining, because of not calculating well in February, we lost many important weeks to prepare. If only the government did realize on December 31st, when China declared the pandemic in Wuhan, or January 23rd, when Hubei province, Wuhan as the capital, being locked down. At the same time, the government immediately closed down the direct flight from Wuhan to Jakarta, daily flight, Wuhan to Bali. Maybe the number of infection is not going to be this high. And of course, we had more times to buy ventilators, to prepare hospital beds, etc. President Jokowi only declared the first two infections on March the 2nd, meaning that from January 23rd until March the 2nd, we have more than 5 weeks in between. It was a very crucial 5 weeks.
And Andreas, regarding to religious practice, we all know that we have got some cases from mosque attending from Indonesia and Malaysia to Thailand. But what happened in Indonesia, has it been adjusted in terms of practice in the mosque?
Well, not 100%, because we had big gathering in Goa, in southern Sulawesi. There was a Jamaat tablik, just like the one in Kuala Lumpur, just like the one in India and Pakistan. They also held their annual gathering in South Sulawesi. And not only the Muslim, there are also clusters breaking up because of Indonesian churches. One was in Bogor, in West Java, another one was in Sumedang, Evangelical Church. There are 3, and then another Bogor, Muslim gathering cluster. So we have 4 clusters of religious gathering, and these are the one that spread the infection among many churchgoers and also among Muslims. The government at the time was still negotiating to close it down. But again, in South Sulawesi, for instance, there are already 8,000 people gathered when finally they agree not to continue with the public gathering. But at the same time, we are lucky because 2 or 3, the largest Muslim organization in Indonesia, the Nahdlatul Ulama, the Muhammadiyah, and the Indonesian Ulama Council, immediately issue a statement that Muslims need not to have the Friday prayer. They are using theological argument, Islamic argument, that according to the Quran, we can move the Friday prayer from mosque to our respective houses, home. And also, we are going to face the Ramadan fasting month. And at the end of the Ramadan fasting month, there are 75 million people who will do the homecoming in Indonesia. 75 million people. And this Muslim organization already called on their members not to do the homecoming. And the government is thinking about increasing bus fare, train fares, plane fares, airfare, so that people will be discouraged to go home. But 75 people is not easy to handle.
So Andreas, you were talking earlier about how authorities in Indonesia have been using the defamation law to target the government's critics. Can you talk about some of these cases?
There is a case on Instagram, a man who said that this virus is really made to justify massacres. And then there is another young man who questions President Jokowi's policy, refusing a national lockdown and calling President Jokowi, quote unquote, stupid. And then and he said that it's time to raise the idea of setting up an Islamic caliphate in Indonesia. He was also arrested, now still under police questioning. And then there are 6 so-called anarcho, the anarchic network. They are also being arrested. The police charged them of trying to incite riots against what the police claim to be rich people in Indonesia. So there are people that are being arrested. Of course, Human Rights Watch don't think that in a time like this, it is silly to arrest people just for criticizing the government. What the government needs to do is to provide accurate daily statistic information in a bit, not only to balance or to counter what these people have been saying, but to provide the public with trustworthy, accurate information in a very difficult time like this.
And Andreas, how does media community can work? What the space that they can work independently in this situation, and also what's happened in social media?
Well, I have to say that Indonesian journalists in general are doing a good job. They are working under very, very difficult situation, not only because they cannot do their daily reporting, they miss the gossip, the atmosphere of doing on-the-spot reporting. They have to do it from a distance. They interview with Skype, with WhatsApp, or Zoom. Press conferences are being held with Zoom. But at the same time, many of these media companies suffer severe decline of their income because of advertisement are declining. Businesses are in decline. Thus, they do not advertise. TV station, newspapers.com, they also suffer quite a hit with this outbreak. So this is a double challenges. One is the work is becoming more and more difficult. At the same time, income is in decline. Meanwhile, in a crisis like this, wherever it is, in Bangkok or in Jakarta or in Kuala Lumpur, in New York, in London, the better the quality of our journalism, especially in a crisis like this, the better the public opinion that is being informed, shaped, and then the better the society will react to the crisis. On the contrary, if the quality of journalism is in decline, then how the public react to this outbreak is also in decline. Thus, journalism is very, very key. I'm really worried to see how many Indonesian media companies are being hit by the crisis as well.
Yeah. Andreas, I cannot agree with you more, because in circumstances like this, the role of the media is very crucial indeed.
It is very crucial. This crisis, unfortunately, reminded me to the Asian economic crisis, 97-98.
Yeah.
Then it was an economic crisis, and later shifted into social crisis, political crisis. In Indonesia, unfortunately, it became ethnic and religious violence. 90,000 people were killed. I really do hope that we have learned from the mistake that we did 20 years ago. President Suharto was toppled 20 years ago. But at least we do not have as much blood being spilled like what happened 20 years ago in Indonesia.
Andreas, any uplifting side, any cheerful stories you can share with us from Indonesia?
Oh, solidarity is civil society, human rights organization, religious organization. Many of them are very inspiring. There is a top-notch fashion designer who changed her factory into producing hazmat suit. Yeah. There is a religious organization called the Gus Durian, the proteges, the student of the late Muslim scholar Gus Dur, or Abdurrahman Wahid. They organize free lunch boxes, dinner boxes for many people on the island of Java and many other cities around Indonesia. There are also many free classes if you want to learn a lot of things. There are many free online classes that you can attend, whether it is about cooking, whether it is about baking a cake, writing classes, poem recital, discussion about movies. They are all emerging all over Indonesia. And of course, children do enjoy. I'm afraid that many of these children will graduate without having national examination or whatever examination. They will just go back to school one grade higher. They love it.
All right.